Okay, at 6 p.m., Tuesday, January 26, 2024. Call order, Chickasaw County Board of Supervisors meeting. Roll call. We have Supervisors Sukow, Hackman, Kuhn, and Greitbach, along with Sheila Shackleton, Auditor, and Board Secretary. Can I get approval of the agenda?
So moved.
Second.
Second.
Motion and second. All those in favor?
Aye.
EMS Director Joe Knudsen, discuss EMS department.
All right, well, we'll start here. If anybody shows up, we can kind of catch them up to speed, but thank you everybody for coming tonight. I know we met back in July. We've made some pretty significant changes from where we were 6 months ago. And as part of the agreement that all the cities entered into, this is just the yearly update of where we're at. So we'll talk a little bit about, as we go forward, we'll talk about call volume, we'll talk about call breakdown by zone, where the calls occurred. And then from there, we'll kind of break it down a little bit even further. Sorry, I should turn off the light so you guys can see that. Is that too much, or I don't know? So, excuse me. We'll talk about call breakdown by zone. We'll talk about the types of calls we had, the significant ones where we saw a pretty big impact. And then we'll go into some budget expense details, some revenue details, and then we'll wrap it up with a Q&A at the end. So call volume, January 1st through December 31st, we had 935 calls for service. Of those calls, we transported approximately 84% of them, which is pretty standard industry-wide. 135 of them were no patient transports. Either they refused to go with us, they were a lift assist, we helped them back up, put them back in their chair, or they were deceased or there was no patient there to be transported. And then 14 fire standby types. So for those who aren't familiar, anytime a fire department goes out in the county for a structure fire or accident or anything like that, we go out with them. So,
Joe, question.
Yeah.
Does a home football game call a standby?
it is not.
Nope, so that's not on that list.
That is not on that list, correct. So we keep track of those in a separate way so that they are billed as a public service. And eventually that leads into helping us with our GENT reimbursement in the end. So, further breakdown of the transports that we had, 311 of them were inter-facility transports, so hospital to hospital. 475 were 911 calls for service. So by breakdown, by zone breakdown, as you can see up the top, City of New Hampton, city limits, we had 393 calls there. Chickasaw County, not in a city, 365. 81 in Fredericksburg, 36 in Lawler, 14 in Ionia, 8 in North Washington, 4 Bassett, and then 34 were unreported. I don't know if you guys remember from the 6-month meeting we had like over 200 of them not reported. So we did get that fixed in our billing software. So these are pretty accurate numbers. The unreported ones that we currently have in our system are just from transfers taken from other facilities out of our county that don't have a zone to be assigned to. Of the calls that we took, the call breakdown kind of fell like this: general medical calls, this, your respiratory, not feeling well, nauseous, so on and so forth. General medical calls, 668. Traumatic injuries, so falls, car accidents, anything with traumatic injury, 196. We had 6 cardiac arrests in the county for our service district this year. Priority 1 STEMI activations. So for those who don't know what they are, that is when our crew goes out, determines that somebody is having a myocardial infarct or a heart attack in the field. We diagnose it and we take them straight to the cath lab, which has been Allen and Waterloo. So we bypass our local hospital because they need that higher level of care. They need that cardiac cath lab that only the bigger hospitals have. So we had 6 field activations of a heart attack that we took directly to a PCI or a cath lab. And we had 4 priority 1 stroke activations where we took them directly to a stroke center, which also ended up being Hamlin for all 4 of those. So the protocols that we have in place are pretty important for that. That's really, you know, in days gone by, a lot of these patients were taken to a close hospital. And then it didn't used to be as big of a deal, but since COVID, bed availability at bigger hospitals has gotten a lot tighter. And so just because you go to New Hampton doesn't mean necessarily that you're going to get to go somewhere else, because they have to have a bed available for you. So by bypassing our local hospital, these 10 patients got the higher level of care that they needed right away. So that's something that the state tracks with us, and in talking to our state partners, something to be pretty proud of. So level of care. For the year average, we averaged 96.7 paramedic response in the first out ambulance. Just as kind of how it went, ebb and flow, we started out very high. We had a lot of people want to take vacations during the summer, so we were falling off a little bit. Now that we come back into the first part of the year, we've had a paramedic on the first out truck 96.7% of the time. So it's better allowed to serve our partners at Mercy One in New Hampton, transferring patients to the higher level of care that they need. 82% of all interfacility transfers on Mercy One require a paramedic attendant. So that's where we're seeing our increased call volume from year over year. The more times we have a paramedic on a truck, the more transfers that we can take out of Mercy, increasing our revenues. So some numbers shared by Mercy, and please don't misconstrue this. This is not talking negatively about anything prior to the county's ambulance coming online. This is strictly the numbers that Mercy shared with us and that I thought should be shared with you folks. So from January 1st, 2021 to March 15th, 2022, there were 75 delays due to not having a paramedic for coverage to transfer. Average time a patient was waiting for a paramedic transport in their ER was 107 minutes. So January 1st, the county's ambulance started. From January to June, they had 103 transfers, 3 having to be transferred by an outside agency due to no paramedic being available, and 5 being transferred had to be transferred by another agency due to our truck already being out on a transfer for Mercy. As you remember, September timeframe, the county got their 3rd ambulance and got it into service. That helped a ton. As you can see, from July to December, we did 118 transfers, 4 of them having to be transferred by an outside agency. So we cut that in half. And those 4 most likely occurred prior to September 1st. I don't know that we've missed anything out of there since. So Mercy, they've been a great partner to work with, and they've been very positive on what we've built. So utilizing our resources appropriately, as we talk about that, on average, twice per month since September, all 3 county ambulances have been activated to provide patient care. Christmas Day was one of them. So because of that 3rd ambulance, we didn't have to utilize outside resources. We had all 3 trucks moving at one time, and that's kind of a big deal. As we'll talk about a little bit more, the Fredericksburg crews have been paramount in seeing that succeed. As it sits right now with that 3rd truck, we're averaging 2.5 in-facility transports from outside facilities per week. That's a very fluid number. We may go 2 weeks without doing any for Floyd County or Sumner, but then we'll do 4 or 5 of them in a week. So it just, it's a very fluid statistic, but it averages out at 2.5. So, ambulance station in Fredericksburg continues to be vital. Since going into service, they've responded to 56% of the requests that have been in that district. We expect this number to increase as we bring new staff on. So, I think everything I've heard in the city of Fredericksburg, folks here tell me if you've heard something different, but it's been a good thing down there, so. The ARPA funds breakdown, this was in the 6-month presentation. I left it in here just so you guys could see it again, and you've got it in front of you again. The only things that we added were the EMS building and the EMS equipment. So 2 line items there. So our EMS budget, total fiscal activity for the year was $823,778.84. Of that, $633,141.02 was our wages. Medical supplies, $24,000. Fuels, $15,000. Data claims processing, $21,000. So that's PCC, our billing company. That's what pushed us this year to do our billing for us. EMS education, that number is because we're sponsoring one of our EMTs to go through paramedic school. So she's doing very well. We hope by growing our own employees, that's going to help us in the long run. Motor vehicle maintenance, $2,400. Building maintenance, $5,500. Crew quarters rent of $11,500. That's renting the house that we had in town. That's renting the apartment that we're currently in. We hope to see that disappear next year. Vehicle building rent, that was when we were renting from the city of New Hampton to station our ambulances from January till August. That has disappeared. We won't see that again. Insurances, so workman's comp, liability, malpractice, all of those insurances, total of $59,130. EMS equipment, $24,608. And then just everything else. The uniforms, the background checks, stationary equipment, office stuff, that kind of stuff. Totaled $8,140. So any questions on anything you saw of our?
Yeah, Joel, on the screen before, EMS building data processing, does that include the 4 we did like yesterday?
That would not have included the 4 that were done yesterday.
So yeah, the board approved 4 claims for the months of what, September, October, November, December.
Correct.
And that was like 20,000 roughly, or you remember?
I thought they were about 4,000 apiece. 16. This was the numbers I had prior to, and there was some confusion on my part. Thankfully Sheila and I helped. I thought it was January 1st. It's actually January 15th is when we certify our quarterly report. So should these numbers reflect the 15th versus the 1st?
Yeah, I don't know.
And they might be off a little bit, not a ton. So just that would be one of them, but that was pretty much the only claims that got sent through. So revenue as of the 15th, Chickasaw County has contributed $743,001. $1. They have paid the January 24 and April 24 payments already. New Hampton is at $356,904. Fredericksburg is also, their number is a little higher because they've contributed their January 24 payment. Waller, $14,000, Ionia, $23,000, North Washington, $11,000, Bassett, $4,000.
The county share was like 460 some thousand.
Right, remember.
So he's adding the calendar year.
So.
Can we go back though? Why hasn't Waller, Ionia, Washington, Bassett paid their January 5th payment?
This is as of December 31st, and what was all paid up till December 31st. So they have paid it in January.
Ours is paid, it just hasn't gotten in the books, apparently.
Well, then why would you put a note on Fredericksburg's?
It was received in December.
What's that?
It was received in December.
Oh, so then I don't know if you should say January 15th. I should, you see what I'm getting
I do.
at?
And I have to, full disclosure, I am learning so much about accounting. It's going to drive me insane.
So
But
with,
would that be better to say January 1st?
by January, well, for the county's payment, we paid everything for a year at the beginning of the budget season.
So we paid for 18 months.
That's basically too much, yeah.
Yep. That's why it's confusing.
I apologize, I'm still learning the accounting.
And that's why the cash pool is so high.
Correct.
Correct. So continue. Yeah.
So on the other side of the revenue, 911 calls to date, we've collected $168,000, EMS transfers, interfacility transfers, $187,000, grants, donations, $5,500, reimbursement refunds. So in that category, there was the security deposit that we received back from the house that we were renting, and then the reimbursement from the insurance companies for their adjustment at the end of the year. Interest earned at First Citizens, $21,367. Current balance in the EMS account as of the 15th, end of business day, the 15th. I'm pretty sure this is correct? 954,
No, it was
963.
954,760.29.
And that's what's on the letters that you gave
Yeah.
to the five,
Yeah.
six cities, sorry.
Yeah, I thought we resent you a new cash fund,
No, this is the one that I got. This is the last one that I got this afternoon.
because we, okay,
Changed it. Okay,
so the ones that we certified are the, and it's $203 off.
okay. Then that number is $203
Less,
less.
yeah.
Okay. I apologize. I misunderstood your email then because I thought this was the last number that we had come up with today after reconciling it. So in the handouts for you guys, for the cities that got them, the EMS financial summary, let me know if you need more light to look at this. So the financial summary basically shows by month what we billed, what we received. I guess some key takeaways, if you look at the end total for the year, we billed $1.5 million after the insurances that we've signed contracts with put their contractual adjustments out. We have a gross net charge of just over $1 million. The insurance companies have paid $338,000. Patients have paid $17,000. Aged accounts by payer. I included this because this will kind of show you the revenue that's yet to come in. Because we're still working and resubmitting claims with insurance companies that have been denied. So just going down through there, I mean, Amerigroup Iowa, which is a Medicaid, has $68,000 that they still have outstanding with us. Medicare B in Iowa has $158,000 that are still outstanding with us. So we're actively looking to recoup these numbers, and that's what our billing company is doing for us. So. Just as a review, our billing process, PCC, as I've mentioned before tonight, is our billing contractor. They send out billing batches to the insurance companies, averaging bi-weekly, 30 to 45 days to pay their claims. If it's submitted, if it has to be submitted, or if they need additional documentation that we didn't provide in our EMS report. They handle all of our denial of claims and resubmissions. Payments come through my office, and then I send them up to the treasurer. So we're moving towards mostly ACH accounts where the money goes directly into our bank account, and I just have to say which account it goes into. That will continually, hopefully going forward, so we have less paper checks to handle. I don't know if anybody watched the meeting on Monday, but moving forward, the county will be looking at some sort of a process of collecting our outstanding debt, whether that be through a collection agency or for some other means. So, as I discussed on Monday, and I'll talk about it now, the state of Iowa used to have what was called the offset program, where you could recoup some of your outstanding debt from people's state tax returns. Unfortunately, when it moved from one department within the state of Iowa to another, EMS got left out of that. Municipal hospitals are still able to, but EMS got dropped. As I said before, I talked to a couple of our legislators. They think it was an oversight. They're hoping that we get back on it, but there's no guarantee on that. So when that happens, we'll file for that program and we'll go forward with that. So just to kind of end on a happy note, and some positive things that we've done throughout the community this year. We've participated in a lot of parades. We've done a ton of PR events. I mean, all of this stuff is excellent for us. It's got us out in the public. The public knows we're there. Halloween, we had over 100 trick-or-treaters come to the station. All of that candy was supplied by the membership, and we had people in our ambulances, people going through. I've said this in every EMS occupation I've ever worked. The first time somebody sees an ambulance shouldn't be the day they call 911. So these kids that are coming to us and getting to go into our ambulances and getting familiar with us, should they ever need us, there'll be that level of comfortability with us. Another neat thing that we got to do is we participated, Brandon Anderson, one of our EMTs, participated in a wreath laying ceremony at the Waller Veterans Memorial. That was pretty cool for him. And here's just some other pictures of us meeting with some daycares. That one was down in Fredericksburg. So I believe that's the Dairy Days parade too. So our goal for next year is to take more pictures. If you haven't liked and followed us on Facebook, please do. We try to send out some PR stuff on there. And we also like to send out medical stuff and good reminders. The last one was about the cold weather. So with that being said, I'll open it up for any questions for me. If I can try to answer or clarify anything for you guys. Yeah.
On your diagram of your revenue and that, based on the amount that you have received from insurance and that, on those particular claims, do you know what your write-off amount was because of Medicare and Medicaid? Because I think that's an interesting figure for people to know.
Yeah, so it was up there for the year. We had contractual adjustments of $525,000. So we billed 1.5 million. We had contractual adjustments of 525,000, giving us a gross net of 1 million. That was on that slide.
The actual cash received was closer to 300,000, right?
As of yet, but as we can remember, so I got a explanation of benefits this morning from Blue Cross Blue Shield. We're still, in Blue Cross Blue Shield, Medicare, United Healthcare are probably some of our fastest payers, and we're getting payments from date of service in September, early September. So that just tells you how far behind we are. So
you're 3 months behind on getting payments, but you're still almost 400,000 in the hole on what it costs you to operate for the year by my
correct.
simple
Yep.
math.
Yep.
So
So, and that's where we're behind, and that's just the first payment. So that's the primary insurance. So then you've got secondary insurances, then you've got private pays or the copay part of it that still comes in. Yeah, it's who pays first. They normally pay the biggest amount, and then it's your copay, and then it's your, your privates or your supplemental insurances. So,
So yeah, if you look at your accounts receiving, which you guys don't have a copy of, but, so like in January, there's accounts receivable of $115,000. February was 231,000, March was 355, April was 300, May was 290,000, June was 415, July was 425, August was 554,000. Same for September roughly, same for October. November was 648,000, and December shows accounts receivable of 672,000.
And that's a fluid number, right? Like as money comes in, that number goes down. As we bill more, that number goes up. So it's always kind of a floating number.
But you can see it took till like the third month to hit 355,000,
Right.
which then it kind of did the little curve like you're talking.
What is your refile rate that you have? That where your claims have been denied for one reason or another, you have to refile them?
Percentage wise?
Do you have a percentage on that? No.
No, I can ask PCC and.
Do you know what most of the reasons were?
Things that we're working on, I guess I'll put it that way. I don't know how, so what Doreen is referring to is, insurance company denies us for some reason or another. Now, why did they deny us? Did we not write a good enough report? Did we not attach the correct paperwork? Did we not have a physician certification statement on that paperwork? A number of reasons. You're never gonna get 100% first filing because it's the insurance company's job not to pay you. But things that we can do, and we're working on it, is writing a better report, having all of the necessary paperwork the first time when we submit it to the billing company. The good part about the billing company is they are excellent at reviewing our reports and saying, hey, you don't have a PCS attached to this, can you go get one and send it in for me? They're excellent at going, hey, I think your EMT, your paramedic got distracted and wrote half of the narrative and then locked their report. So that kind of stuff, they send back to us, we fix it, they send it in. So, but as far as a percentage, no, I guess I don't.
How much delay is it if you have to resubmit it? Is it like 3 months or?
30 days probably, I would guess. I don't know. Yeah, right. Yeah, and the unfortunate part of it is, I mean, and this is certainly not anything that can be solved here, but it's the insurance companies that we deal with. They make you sign a contract to get paid, and then they give you a percentage of what you bill. And then they try their darndest never to have to pay you. So that's what we deal with. Any other questions?
Keep up the good work.
I will, I'll leave a handful of my business cards on the table. Make sure you grab one on your way home. If you have any questions for me, please reach out. As far as our cities that are here, if you want me to come talk to your city councils at your next meeting, let me know. I'd be more than happy to come down there. I know not everybody from the councils can be here tonight, so I do travel, so that's fine. I can come say, hey, wherever you're at, so.
I just have to say it was the best case scenario of the first quarter that we met, we're over the 750,000 to waive the payments to the cities, which I didn't expect it. So, this is a huge thing for the citizens of the county.
I'm optimistic looking at our financial statement that these numbers, as folks who have this, one thing you may notice, Veterans Affairs. So we have an outstanding of 55,000 with the VA. VA pays very well, but we're still negotiating a contract with them almost a year later. So they move at government speed. These Medicare, Medicaid, Veterans Affairs, they're all government programs, and so they move at government speed. And unfortunately, that makes it, I'm optimistic from talking to the billing company that we're going to be able to back bill and they will pay us for everything. It's just getting that contract written and signed with them. That's been, everything's submitted on our end. It's just them finding their feet.
Joe, you want to take your ARPA fund numbers? I have a different number than you had, so. I have about 4,325, 4,400. It's off 1,200 bucks, I think. So I don't know. Gotta have to go through each line item, but.
That's what I came up with after adding from that report, but then again, but we haven't spent anything out of ARPA in my department for.
Just double check the records with Sheila.
Yeah, I will.
There is a pending budget amendment
Yeah,
to pay back out of your budget the 15,000 roughly that we had to pay for the Lucases, for their maintenance contracts. That was a previous motion to pay out of ARPA. So that will be being added to ARPA, taken back out of your budget to show, boost your budget a little bit.
yeah.
I was gonna say, just so people in the public are aware, because I don't know, Jake referenced it and Steve referenced it as well, but the 2080s do say that if the amount in the dedicated account is over $750,000 for 2 consecutive quarters, beginning now, then the next quarterly payment is waived. So Sheila sent a letter to all the cities today that said that January 15th is the measuring stick. That was yesterday. It's over that number. So if it's still over that number on April 15th, which will be the next time we look, then the July 5 payment of 2024 will be waived until it falls below that number again. We talked about that when we put this together, but
And is that checked daily or is that just at those dates?
quarterly amount at that time. So if it's under 750 on April 15, close of business on April 15, the payment will not be waived automatically. If it's over 750, the payment will be waived automatically for July of 2024. That quarterly.
And then July 15th will be the next
time it's measured. Yep, so it's measured every quarter and it goes to the next quarter. So if it's 780 on April 15, the July payment would be waived. If it falls below 750 by July 15th, then that September payment would be back in force then the quarterly payment. So it's always a quarter trailing from when the measuring is done.
And my fear is, I think, potentially the April 5th would be triggered. But make sure you still budget for the April 15th one.
Yes, because that's when the measuring is.
But still budget for next fiscal year, those 2080 numbers that was sent out by Sheila 3 or 4 weeks ago for budget worksheets. Hopefully it's waived, but not necessarily. Just make sure the funds are in the budgets.
Is there any more questions for Joel or the
What's the
supervisors?
update on the building?
Pardon?
What's the update on the building?
So I guess on my end, or I can share what I know. I spoke with the architect today. He's hoping to have us a final number to be presented at the January 29th meeting. So we revised it a handful of times. We should have a concrete number by the January 29th meeting.
Do you want to explain, you can explain, Joel, why the updated drawing has to be done
Yeah.
with the fire marshal and.
Yeah. So, so initially when we put this project together, there was some confusion, about what was gonna actually be required. In doing some reworking, we were able to reduce the cost of the building, we believe substantially, by redesigning how we did a few things, which is great. That's going to come at a huge savings. And so what the what the delay is now is that we needed to put a second means of egress out of the second story, which just entailed putting another set of stairs to the outside. So we have somewhere to get out of our sleeping quarters.
And then add the 2-hour firewall.
The 2-hour firewall to separate the apparatus bay from the living quarters. Yeah. So once it's complete, and for those who aren't aware, my office will be there. There'll be a small kitchenette, bathrooms, sleep rooms for our staff that travel. So
That answer.
And then the funds come out of this EMS fund to pay for that.
Hasn't been decided yet. Don't know what the number is.
What are the other options?
So there's a balance of ARPA left yet. Yeah.
That would be great. I mean, if you could use the ARPA funds or even bring it back to the vote, like we talked about a year or so ago, bringing it to the vote for people. But, yeah, just wondering how it's gonna get paid for.
Well, the pending budget amendment has $600,000 getting transferred to, farm to market. And then that would leave about $50-some thousand left in ARPA. So if that budget amendment passes, there won't be money for ARPA to pay for the building. It will come out of the cash pool of the $954,000. So if that budget amendment passes, that won't happen.
So we won't have ARPA funds.
Correct.
Any
You do have
consideration?
ARPA funds though.
You have a
Pardon me?
third, you have a third of it in ARPA yet.
Of 50,
Roughly,
yeah.
assuming 100.
But not enough to do the whole project.
Where the other option besides ARPA, does you have capital projects money?
Yeah.
Yes.
So that could be utilized also to pay for the remodeling?
I'm not in favor of that, because that's all county money. Cities of Nashville and all destitute.
Yeah, but it's a county building.
It is.
So there's $50,000 there. And then is there any consideration to, if, nothing against secondary roads, but they had $600,000 dropped in their lap, and I don't know, maybe he has means to utilize that money, for valid purposes. I'm not saying that. Is there any consideration of maybe just?
I guess the question I heard was, what do you want me to do with that? Because that's not gonna complete a project.
Okay, I think I remember, that's what I remember too. Just a thought, the city's done it, things have changed, and original plans have changed a little bit, so we change.
And I had brought up too, I'd gotten some questions on how secondary roads should be budgeted. And I brought up that you also received the $600,000. And the comment was, well, I didn't ask for that. So,
Okay, just asking.
So every month of the pool, I got ARPA with $675,799 as a balance, plus about $2,100 interest for this month. So that'll be about 77,000 minus, would you say, Matt? Was it
roughly
50?
15, yeah.
So it'd be 60,000 left.
Okay, so 10,000 more.
Yeah. And then I guess Joel, how's the 501c3?
it's in the process. That's what I can tell you.
And in this budget amendment, did we put in the interest amount? Cause I believe we had just put in the 50-some thousand that was left. I don't think we even have the interest budgeted, so.
Back to Jake's comment, and I should have updated this in the slides, so there's a group that's working to apply for a 501c3 nonprofit, to help for fundraising efforts. With that being said, we are still going forward and fundraising on our own through the county. It just makes it a little more difficult because, as you guys have seen, we have already received donations, but then they go into the accounting, they go into our account.
Right.
And then it's, even though our account is restricted, it's still a line item that has to be accounted for. Not saying that we're not doing it because of that, we are moving forward with fundraising efforts, but it'd be a lot easier and a lot simpler when we have our own nonprofit. With that being said, as you saw in there, we applied for $5,000 worth of grant and received of last year. To date, we've applied for about $35,000 worth of grants. So we hope positive things after the first of the year that we're gonna start seeing some of that stuff come to fruition. But it's unfortunately a lot of people applying for a small amount of grants, so. But we are trying to get as much grant revenue in as we can.
What is the nonprofit funding potentially gonna go for?
Whatever it needs to, I guess, to be honest. So if the building is completed, as you and I talked, if the building is completed before our fundraising efforts come to fruition, we'll probably use it to purchase our next ambulance in 5 to 7 years, whenever that needs to be replaced. So it'll be a huge deal if we could purchase our own ambulance through the nonprofit, saving $250,000 from the taxpayers, because that's, I'm sure, where they're going to be by then. Maybe less for a remount, but yeah.
I'd just like to say thank you to you and all the staff for figuring out a lot of negative things, but I think it's important to show that there was a lot of lives impacted by this service.
Yeah, I appreciate that.
Thank you.
We've heard a ton of good things from the public. They've come up to our crews and yeah, it's been, I didn't know that we would be standing here the way we are today a year ago. So what we've accomplished in the last year has been pretty interesting. So I'm very excited to see what year 2 and 3 and 5 and 10 and so on bring. But if it's any indication how year 1 went, it's gonna be good. So.
Thank you.
Any other questions, comments?
I'm just gonna say, I wanna thank the taxpayers too, because 1.3 million came from the federal government. I think if we didn't get that, you'd be so far behind.
Yeah.
So I'm gonna thank the taxpayers also.
If there's nothing else, I'd entertain a motion for adjournment.
So,
Second.
All those in favor?
Aye.
We're adjourned at 6:42.
Hey, try it. Were you first or was it Jake?